Ever feel like you're seeing more hair in your brush than on your head? You're not alone. I used to think hair loss was just about bad luck or getting older, but here's the exciting truth. Understanding the why behind hair loss can completely change how you approach it. Imagine if the key to a fuller head of hair wasn't just in expensive treatments, but in understanding what's really going on beneath the surface. If you can understand the cause, you can understand the treatment. Hi everyone, I'm Dr. Mamina a triple board certified dermatologist, internist, and dermatopathologist. I treat so many hair loss patients in my office. I've been treating patients for over 16 years. I've also personally dealt with hair loss over the last 20 years, like since I was in medical school. And I have more recently dealt with postpartum hair loss. So I understand the feeling, it sucks. I'm here to help you learn more about it and how to tackle it. So yes, today we're going to talk about hair loss. Whether you've noticed a little bit more shedding or significant shedding, understanding what's happening is really the first step towards feeling empowered. I'm here to share the science and the practical insights to help you navigate the world of hair loss. So let's get started. So our hair is more than just something we style. It plays a huge role in our identity and our confidence, but when we start to lose it, it can really be concerning. The truth is, hair loss, or alopecia, which is the medical word for hair loss, it's not just from one thing. It's really normally a complex issue influenced by a mix of genetics, hormones, health issues, and lifestyle changes. In recent years, dermatologists and researchers have made significant strides in understanding these factors, giving us more tools than ever to diagnose and manage hair loss effectively. So what's really happening? Let's dig into some of the most common causes of hair loss. So first we have genetic hair loss known as androgenetic alopecia or pattern baldness. This is often the most significant factor when it comes to hair loss in most people. So whether it's male pattern baldness that, with that receding hairline and thinning at the crown, or female pattern baldness with widening of your center part and just overall thinning, genetics plays a huge role with this pattern. This is all about how your hair follicles respond to androgens. These are different hormones that affect your hair follicles like dihydrotestosterone or DHT. Speaking of hormones, next up, hormones. These are powerful messengers in our body, and big hormonal shifts throughout our life can directly impact your hair. So some women experience shedding after childbirth, a condition called postpartum telogen effluvium. Of course, changes during menopause or thyroid imbalances. These can all affect the hair growth cycle. I also think that birth control pills can play a really big role, and those obviously are affecting our hormones. Sometimes hair loss is a sign that something else is going on in the body. So conditions like alopecia areata, this is where your immune system attacks your hair follicles. That's an autoimmune condition. There's also lupus, which is another autoimmune condition, but that can just show up as like hair thinning. And then there's like scalp infections, like things like ringworm that can lead to hair loss. So identifying and addressing these underlying issues is key. And then of course, some medications that we take for other health issues can have hair loss as a side effect. I already mentioned birth control pills, of course, chemotherapy. There's also certain blood pressure medications, antidepressants, blood thinners, and even like too much vitamin A can contribute to hair shedding. So always check with your doctor about your medications that you're taking. As a dermatologist, of course, I go through like a thorough medical history, and I also make sure I go through all your medication list. And we, of course, all know that stress can affect our bodies in so many ways, and our hair is probably one of the biggest culprits of stress. Significant emotional or physical stress can trigger a type of temporary hair loss called telogen effluvium. So this is when your hair reacts to a shock to the system. So for example, if you have surgery, a death in the family, if you deliver a baby, any kind of big stressful event can then shift your hair into the resting phase, because it's like, let's not put any energy into letting your hair grow. It goes into the resting phase, and then like that resting phase then lasts for a few months, like 3 to 5 months, and then the hair sheds after that. Also, how we treat our bodies and our hair can play a huge role. Nutritional deficiencies like low iron, low zinc, low vitamin D, also things like smoking, or if you have like really harsh hair care practices, like wearing really tight hairstyles. I know some of them are like really trendy, like the tight bun. These can put a strain on your hair follicles. I know everyone really likes that tight hair bun, but these practices can cause a strain on your hair follicles. And then of course, things like excessive heat, like all the heating tools that we love to use, can cause some damage. So let's talk about like the different types of hair loss. It's not just about losing hair, but how we lose it that can tell us a lot. So for example, if you have like patchy and sudden hair loss, where it's like just little circular patches of hair loss, often this is alopecia areata, which is an autoimmune condition that I referenced earlier. You'll have these round or oval patches appear seemingly out of nowhere. It's so stressful, but it responds pretty well to medicine. Then there's telogen effluvium, which is that noticeable all over shedding that usually happens 3 to 5 months after a stressful event, which I mentioned earlier. And it can feel like you're losing so much hair, like handfuls of hair at once, like it's so depressing. I always tell people, you're not gonna lose all your hair, don't worry. But it's definitely very stressful at the time because it feels like you're losing all your hair. Then there's a hair loss that's a little bit more intense, anagen effluvium, and this is rapid hair loss that happens during the active growth phase, and this one's often most associated with really intense medical treatments like chemotherapy. I would say that that's like the main situation that we see that in. And then there's traction alopecia, which is caused by repeated pulling or tension on the hair from tight hairstyles, like a tight, nice bun. And it's often localized to the areas where the hair is being pulled. So we'll see like receding hairline, in the front here. And don't forget about fungal infections like tinea capitis, also known as ringworm. It can affect the scalp, causing scaly patches and hair loss, and it requires specific antifungal treatment. So how do dermatologists diagnose hair loss? Well, if you're concerned about hair loss at all, obviously seeing a dermatologist is the best first step. They have several tools to figure out what is going on. So we start by talking to you about your hair loss. How long has it been going on? What are other changes in your life, your medical history, your family history, your surgical history? And then we'll, of course, look at all your medications, and then we'll carefully examine your scalp and hair. There's something called the hair pull and tug test. So this is a simple in-office test that helps us assess how much hair you're shedding and the strength of your hair strands. We also like to use a dermatoscope where we can closely examine your scalp and your hair follicles to get a better understanding of what's happening. We could look at the different sizes of your hairs and see if there's scarring or non-scarring hair loss. And there's a lot of things that aren't really visible to the naked eye. And then of course, if needed, we will order blood tests to check for any underlying medical issues, whether it's thyroid issues or other hormonal imbalances and nutritional deficiencies like low iron or low vitamin D. And then in some cases, a scalp biopsy may be taken to examine under a microscope for a more definitive diagnosis. So let's talk about treatment options. The good news is that there are various treatments now available, and the best approach depends on the type and cause of your hair loss. There's topical minoxidil, aka Rogaine, which is a topical treatment that can help stimulate blood flow to the scalp and encourage hair growth. It's available over the counter and works both for men and women with pattern baldness. Even though it's not FDA approved for hair loss outside of pattern baldness, I do think that it's helpful for honestly most forms of hair loss. So I think it's still a good place to start if you're not sure. Now for men, there's prescription finasteride and sometimes dutasteride. These medications help block the hormone DHT, dihydrotestosterone, which is a major player in male pattern baldness. And then I will also use this off-label for postmenopausal women. Spironolactone is another pill that can help address hormonal influences on hair loss. We only prescribe this for women though. And then there's oral minoxidil, which was originally used for blood pressure, like back in the 70s for high blood pressure, but it can be taken at very low doses for hair growth, which is honestly, I see great results with it. And then there are certain in-office treatments. These include things like cortisone injections, which we do often for people with like localized alopecia areata to calm the inflammation. And this helps encourage regrowth. There's also microneedling with platelet-rich plasma, or PRP. So PRP is derived from your blood and we inject it into your scalp. It's full of growth factors and signaling molecules to help rejuvenate your hair follicles. I use it in conjunction with microneedling because I think that allows the PRP to work better in the hair follicles. Microneedling can also be used itself because that causes tiny punctures in the scalp, which can actually help stimulate growth factors and improve absorption of other topical treatments you want to use. And then there's also low-level laser light therapy, aka like red light therapy. And this can be used in office or at home, but this can sometimes help stimulate hair follicles. At home, you'll find them in like caps or helmet forms. And then there's hair transplantation, and that's an option for people who are looking for a more permanent solution. Ketoconazole shampoo is actually an anti-dandruff shampoo, and I find that anti-dandruff shampoos, so even things like with zinc, like Head & Shoulders, those anti-inflammatory components can also help with your hair loss. There's also smaller studies that show like caffeine can boost circulation in the scalp. I'm also a really big fan of like massaging the scalp because I feel like that's another way to just boost the circulation to the scalp. Let's talk about nutrition and hair health. So just like what I've talked about with skin health, what you eat can also impact your hair health. Nutrients like vitamin D, iron, zinc, they're all important for healthy hair growth. Think of them as the building blocks for your follicles. Other ingredients are things like hydrolyzed collagen peptides. If your diet is lacking in these essential nutrients or in protein, it can definitely contribute to hair loss. We know that a balanced diet is key. I've been personally seeing a lot of patients with hair loss after rapid weight loss with GLP-1 agonists like Ozempic, so that's just another factor to keep in mind. Supplements we know are super popular for hair loss, but it's best to talk to your derm before starting any, especially if you don't have a diagnosed deficiency. I talk all about hair supplements in another video, so be sure to check that out. I'll link it in the description below. So beyond medical treatments, how you treat your hair and your body matters. For example, being very gentle with your hair care routine is very important. You want to avoid harsh treatments, excessive heat, and tight hairstyles to prevent damage and traction alopecia. And like I mentioned earlier, stress is huge when it comes to hair health. So practicing stress reduction techniques like mindfulness, exercise, getting enough sleep, hanging out with your family and friends, these can all make a big difference. And then, like I mentioned earlier, scalp massage, I think just gently is very nice. Some people also explore essential oils. There's a small study in JAMA Dermatology that showed 4 different essential oils to be helpful for alopecia areata. I'll link that in the description below. It's also important to understand the timeline for diagnosis and treatment. It can take anywhere from 1 appointment to several weeks if further testing is needed, and you want to really be patient with treatments. Many take months to show noticeable results. A minimum really of 3 months, I tell patients, but 3 to 6 months really. The timeline depends on the type of hair loss, the treatment, your consistency, your individual response, all of it. So overall, hair loss I know can feel so overwhelming, but understanding the causes, the types of hair loss, and available treatments can really empower you to take action. The most important first step is consulting with a dermatologist. They can provide an accurate diagnosis and work with you to create a personalized plan to address your specific needs. By combining professional guidance with informed lifestyle choices, you can navigate your hair health journey with confidence and explore the possibilities for a fuller, healthier head of hair. It is totally possible, okay? Don't lose hope. I wanted to talk way more about supplements for hair health, so remember to check out this video where I talk about supplements for hair health. Thank you all for watching, and we'll see you next time.